Attention deficit slash hyperactivity disorder, ADHD, represents one of the most common neurodevelopmental conditions worldwide, affecting approximately 5 to 7% of children and 2.5 to 4% of adults across diverse cultures and geographical regions. This complex neurobiological disorder is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that significantly interfere with functioning and development. Contrary to earlier perspectives that viewed ADHD as exclusively a childhood condition, contemporary understanding recognizes it as a lifelong neurodevelopmental difference that evolves across the lifespan, with symptoms often persisting into adolescence and adulthood for approximately 60 to 70% of affected individuals. The disorder manifests through three primary presentations: predominantly inattentive, predominantly hyperactive impulsive, and combined presentation, with symptom profiles frequently shifting throughout development as neural systems mature and environmental demands change. The neurobiological foundations of ADHD involve structural and functional differences in multiple brain regions and neural circuits, particularly those governing attention, executive function, and motor control. Neuroimaging studies have identified differences in prefrontal cortex volume and activity, altered connectivity between frontal and striatal regions, and differences in the default mode network responsible for self-referential thought processes. At the neurochemical level, dysregulation in dopamine and norepinephrine systems plays a central role, affecting motivation, reward processing, and cognitive control. The etiology of ADHD is multifactorial, with genetic factors accounting for approximately 70 to 80% of the variance in susceptibility. Environmental influences such as prenatal exposure to certain substances, premature birth, low birth weight, and early severe psychosocial adversity may interact with genetic predispositions, potentially altering neurological development during critical periods and contributing to symptom expression. Inattention, a core feature of ADHD, extends far beyond simple distractibility to encompass fundamental challenges in directing, sustaining, and shifting attention appropriately across contexts. Individuals with ADHD often demonstrate difficulty maintaining focus during repetitive or low-stimulation tasks while paradoxically experiencing hyperfocus, intense, sustained attention, during highly engaging activities that provide consistent stimulation or intrinsic motivation. This variable attention allocation reflects underlying differences in the brain's arousal regulation and reward systems rather than willful behavioral choices. Inattentive symptoms typically manifest as overlooking details, struggling with sustained mental effort, difficulty organizing tasks and materials, frequently losing items, and appearing not to listen during direct communication. These challenges often become particularly evident during structured academic and work environments that require sustained attention to non-preferred tasks with delayed rewards. Hyperactivity and impulsivity represent the second major symptom cluster in ADHD, though their manifestation varies considerably across development and between individuals. In young children, hyperactivity often presents as excessive motor activity, running, climbing, or moving inappropriately for the context, while older adolescents and adults may experience more subjective feelings of restlessness and difficulty engaging in quiet activities. Impulsivity involves acting without forethought regarding potential consequences, interrupting conversations, difficulty awaiting turns, and making hasty decisions without adequate consideration of long-term outcomes. These characteristics reflect underlying challenges in behavioral inhibition and self-regulation, core executive functions that develop progressively through childhood and adolescence. Research indicates that hyperactive impulsive symptoms often become less overtly visible through development while inattentive symptoms frequently persist, contributing to the historical underrecognition of ADHD in adults who may no longer display the stereotypical hyperactive behavior associated with childhood ADHD. Executive function deficits represent a central aspect of ADHD, extending beyond the diagnostic criteria to impact daily functioning across multiple domains. These higher-order cognitive processes include working memory, mentally maintaining and manipulating information, cognitive flexibility, adapting thinking strategies to changing situations, inhibitory control, resisting impulses and irrelevant information, planning, developing and implementing strategic approaches to goals, emotional self-regulation, modulating emotional responses appropriately, and time management, estimating, allocating, and tracking time effectively. Individuals with ADHD typically demonstrate variable performance across these functions, often performing adequately during novel, interesting, or externally structured situations while struggling during routine, mundane contexts that require self-directed executive control. This inconsistency can be particularly confusing for observers who may mistakenly attribute performance fluctuations to motivational factors rather than neurobiological differences in executive function systems. The diagnostic process for ADHD involves comprehensive assessment across multiple domains, typically including clinical interviews with the individual and collateral informants, standardized rating scales, review of developmental and educational history, and consideration of potential alternative explanations for observed symptoms. Accurate diagnosis requires establishing that symptoms emerged during childhood, though recognition may occur later, persist across multiple settings, and significantly impact functioning in academic, occupational, or social domains. Complicating the diagnostic process is the substantial overlap between ADHD symptoms and other conditions including anxiety disorders, mood disorders, learning disabilities, autism spectrum disorder, and sleep disorders. Comprehensive evaluation is particularly important given that approximately 60 to 70% of individuals with ADHD experience at least one co-occurring condition, necessitating treatment plans that address the full complexity of presenting concerns rather than isolated ADHD symptoms. The impact of ADHD extends far beyond the immediate symptoms to affect virtually every aspect of daily functioning and long-term outcomes. In educational settings, ADHD contributes to academic underachievement relative to intellectual potential, higher rates of grade retention, disciplinary actions, and reduced educational attainment. Occupational functioning may be compromised through challenges in time management, organization, completion of detail-oriented tasks, and workplace interpersonal dynamics. Social relationships are often affected by difficulties with social perception, conversational reciprocity, emotional regulation during conflicts, and consistency in maintaining connections. Financial management frequently presents challenges related to impulsive spending, difficulty tracking expenses, and inconsistent bill payment. Perhaps most significantly, ADHD affects self-concept development, with many individuals internalizing negative feedback about their performance and developing secondary psychological distress, including reduced self-esteem, anxiety, and depression. Evidence-based treatment approaches for ADHD incorporate multimodal strategies tailored to individual needs and developmental stage. Pharmacological interventions, particularly stimulant medications affecting dopamine and norepinephrine systems, demonstrate robust efficacy in reducing core symptoms for approximately 70 to 80% of individuals across age groups. Behavioral interventions focus on developing compensatory strategies, modifying environments to enhance success, and addressing specific skill deficits through targeted training. For children, evidence-based approaches include parent training in behavior management, classroom interventions incorporating environmental modifications and behavioral contingencies, and social skills training addressing peer interaction challenges. Adults often benefit from cognitive behavioral therapy focused on executive function skills, occupational accommodations, relationship counseling, and coaching approaches that provide external structure and accountability. Most consensus guidelines recommend combined treatment approaches that address both neurobiological factors through medication and behavioral factors through psychosocial interventions. The conception of ADHD has evolved significantly over time, from early perspectives focusing exclusively on disruptive behavior to contemporary neurodevelopmental models recognizing diverse symptom presentations and potential strengths associated with this cognitive profile. The neurodiversity movement has contributed valuable perspectives on ADHD, highlighting how certain ADHD-associated traits, including creativity, cognitive flexibility, entrepreneurial thinking, and resilience, may represent adaptive advantages in specific contexts. Rather than conceptualizing ADHD exclusively through a deficit lens, this approach recognizes both challenges and potential strengths, advocating for accommodations and supports that enable success while honoring neurological differences. This balanced perspective aims to reduce stigma, enhance self-acceptance, and shift societal responses from purely attempting to normalize behavior toward creating environments where diverse cognitive styles can flourish. The lifespan trajectory of ADHD involves evolving manifestations and challenges across developmental periods. During early childhood, hyperactive and impulsive symptoms often predominate, with increasing academic and social difficulties emerging during elementary school years as environmental demands for sustained attention, organization, and self-regulation increase. Adolescence brings heightened risk for academic disengagement, risk-taking behaviors, substance experimentation, and driving accidents related to inattention and impulsivity. Early adulthood involves navigating increasingly complex responsibilities without the external structure provided during earlier developmental stages, often representing a particularly challenging transition period. Middle and later adulthood may bring some symptom attenuation as individuals develop compensatory strategies and select environments aligned with their cognitive style, though executive function challenges typically persist to some degree. Recent research has begun examining ADHD in older adults, recognizing the importance of appropriate diagnosis and intervention across the entire lifespan. Looking toward the future, several promising directions are emerging in ADHD research and clinical practice. Advances in neuroimaging and genetic studies are moving toward more personalized approaches to diagnosis and treatment, potentially identifying specific biological subtypes that respond differently to various interventions. Digital technologies offer innovative tools for assessment, skill development, and symptom management, including applications that provide external structure, organization support, and real-time feedback. Educational and workplace accommodations continue evolving beyond simple modifications toward universal design principles that benefit diverse cognitive styles. Perhaps most importantly, increasing leadership from individuals with lived experience of ADHD is reshaping research priorities, intervention approaches, and societal perspectives, moving toward a future where ADHD is understood not merely as a disorder to be treated, but as a complex neurobiological difference with both challenges and potential strengths. This balanced perspective aims to support individuals in developing necessary skills and compensatory strategies, while simultaneously creating environments that accommodate and value neurodiversity.